Hello, everybody. COVID-19 pandemic may be officially over, but it is time to learn some lessons and prepare for the next eventual health crisis. With limited local access to vaccine manufacturing, the African continent was dependent on the world. Vaccines arrived too slowly to curb the numerous variants. The pandemic exposed not only the weaknesses in Africa's healthcare system, but also the deep-seated global and local inequalities. What lessons can we learn from the pandemic? How can Africa and Europe cooperate to boost Africa's capacity in vaccine manufacturing and public health ahead of the next health emergency? In today's panel discussion, citizens from Europe and Africa will share their experiences and pose questions to our experts. We're joined by two citizens, Simina, a public health advocate and organizer in Belgium, and Hamid, an ICT researcher and entrepreneur based in Chad. Richard Amor, head of division of the department in the European Investment Bank that handles the lending operations in Africa, Caribbean and Pacific, Asia and Latin America. And Caroline Mbindyo, CEO at Amref Health Innovations for Amref Health Africa. We also have some pre-recorded insights from Dr. Morena Majuanas, who is the CEO at Biovac, which will also enrich our debate. So let's get straight to it. An issue that emerged during the pandemic is that of vaccine inequity. Simina, can you share your observations and any related question that you may have for one of our experts?
Thank you. My question relates to the process of vaccination, meaning both supply and delivery of vaccines, as well as training and communication strategies to targeting the uptake of vaccination. And I would like to ask both of our panelists, how can we move from vaccines to vaccination? And what can we learn from past vaccination campaigns that we can use for future ones? Thank you. Perhaps
we start with Richard.
Sure, thanks very much. And hello, everybody. It's an excellent question because I think, as you rightly said, it became very clear very quickly at the start of the pandemic that this was going to be an issue that we were going to face across the global south. So I think from our perspective, 2 points I would highlight. Firstly is that the right vaccines have to be prepared for the right geographical area that are going to be used. So it was clear that a vaccine that requires storage in a very, very cold facility was not necessarily going to be the right one for Africa. So making sure we have the right vaccines for the right country. And then the second really key point is about the strengthening of public health systems as well. You mentioned information campaigns and you mentioned how we can increase that vaccination uptick, making sure that local public health systems are ready and able and willing to do that is a critical element, I think, for us to prepare for the next pandemic.
Great question, Samina. I would say that there is no health without a health workforce. And when we think about Africa, even without the pandemic, we know that the health workforce is lacking in terms of numbers, in terms of skill, in terms of distribution. So when we think about how do we distribute vaccines, we need to think about the health workforce that is there. How do we train them? How do we provide them with the necessary skills and the necessary tools required to provide these vaccines? I think another thing is the last mile. We know that majority of the population in Africa is still rural. How do we ensure that the vaccine can reach, to the last communities anywhere in Africa? We're talking about vaccines, and Richard made a great point about the right vaccine for the right context. But it's not in every single case where we'll find that a vaccine is appropriate for a certain context. What if the only vaccine that is available is the that requires a really cold chain? So making sure that the infrastructure that is required is available. How do we finance that infrastructure? How do we make sure that we are resourcing adequately? How do we make sure that we prepare in peace times, so that when a pandemic happens, it is not then that we are trying to get ready for our response.
Thank you, Richard and Caroline and Simina, for your question. Indeed, the real question is, how do we prepare in peace times? And this is why it is important to reconnect and at this point, ahead of any future crises. We had an intervention from Dr. Morena Makwana, who's the CEO at BioVac, on some of the essentials to make vaccine manufacturing in Africa a success. So we'll also hear an important insight from him now.
I think we need to have more vaccine manufacturers on the continent, but those vaccine manufacturers have to be sustainable. And I think that is important. It's a very expensive industry to set up, and it needs to be supported. And part of that support can come in many ways. You know, governments don't run businesses, and I'm a firm believer that they shouldn't. So I think vaccine manufacturing should be private sector led. But within that, because we are an infant industry, we need support from our governments, and we need from other governments as well, in order to get it to the same landscape as, so whatever is happening in the US or Europe can't be the same. We can't do a cut and paste, because as an example, we are a Gavi continent. We buy vaccines from Gavi. And so if I'm a producer and I don't have a Gavi type of product, who's going to be my buyer? So there has to be a market element that where Africa needs to be supported to make vaccine manufacturing sustainable.
Now, moving on to administering the vaccines. Of the 6.4 billion vaccine doses administered globally, only 2.5% have been administered in Africa. And now that more doses have recently arrived on the continent, there are a large population that is still not vaccinated, especially those outside the cities, as Caroline just pointed out. How can we tackle these gaps? And we had a question, and I think these are insights that we've received from some of our focus groups that we've conducted, that it's not about the global inequalities alone, but also the local inequalities and the fact that people who are living outside of the large city centers. So can we get any insights or comments from anybody here on the panel today?
Well, I would say when we talk about access to vaccines, aside from the delay, the inequity in terms of countries not receiving, certain countries having more stock of vaccines than others, I would say that even when we look at Africa, sorry, let me just reorganize my thought.
No problem.
Sorry, thank you. I would say that when we look at inequality within national context, when we look at countries in Africa, for example, there are many areas where when the COVID vaccine was available, there were long lines of citizens waiting to get the vaccine. And we had cases where citizens would wait in line for long periods of time and not get the vaccine. But we also had places where the vaccine was not available. And that was due to things like, of course, the rural areas being harder to get to. The infrastructure available there in terms of cold chain was, less optimal. The health workers were not trained to provide vaccines at those places as quickly as those in the urban areas. Infrastructural problems in terms of being able to get vaccines using the road network or using other ways of getting the vaccine to the citizens. So indeed, there are challenges even when the vaccine is available within the country. But I would say just one more thing, that when the vaccines are available much later, when the crisis is deemed to be over, it is also harder to create the demand, to provide the incentive for citizens to get the vaccine. So as we look at the infrastructure challenges, also let us look at the speed at which these vaccines are made available.
Indeed, very interesting. Speed is equally important in such public campaigns. Richard, would you like to add anything on this?
Maybe just a very small point, because I think Caroline makes some excellent comments there. I think from my side as well is we shouldn't underestimate the regional angle. So making sure that, you know, local African champions and local African actors who know their countries well, know their regions well, who these are the types of people, like whether it's Africa CDC or whether it's, you know, the WHO regional offices, you know, having them at the heart of the rollout and having them at the heart of how countries can reach that last mile, I think is also really, really critical.
Thank you. Talking about local African champions, we have Hamid, with not putting you on too much of a pedestal, but Hamid, you're ICT, you're a tech entrepreneur supporting young people as well. Technology had a huge impact on making vaccines, you know, become a reality. And apart from vaccines, there was a lot of innovation that was taking place. What would you like to say on this point? And I think you have a question for our experts as well.
Yeah, I always look at the angle of the tech. So my question is, many have said that if local manufacturers has been given the technology that allow them to make vaccine, Africa will have been in a better position. What are your thoughts on the IP right conversation? And also, like, it's a following up questions, like how can we use tech to improve the disease surveillance response effort and improve the supply chain management and distribution for essential medicine and vaccine in Africa, in Europe during a crisis, you know?
Richard, would you like to go first?
Sure, I can. I'm very happy to come in because I think, Hamid, you make, I mean, it's a crucial point. It's absolutely clear that technology, innovation was something that was absolutely critical at the time and will continue to be critical as we prepare for the next pandemic. It's going to be at the heart of any pandemic preparedness that we all need to put in place, and Africa certainly needs to put in place across the continent. I think what's also really, really key and kind of looking ahead is this idea of making sure that Africa has all of the elements of the supply chain. So whether this is diagnostics, whether this is personal protective equipment, whether this is vaccine manufacturing, whether this is active pharmaceutical ingredients, Africa needs to have all of those elements on site, whether it's in a regional basis, but has to be there on site, and making sure that it can stand alone and be ready for that next pandemic. I think the other really, really critical point is Africa has got a great reputation, a great track record of making those technological leaps. You know, we travel around the continent, and the number of places where you have mobile banking and where you have, you know, mobile health on everybody's phone, and Africa has shown it has that innovative streak in order to be able to, you know, to make those leaps and make things available on people's in a high-tech environment. I see that as absolutely a key for the next part of for the next phase. And an organization like ours at the EIB, what we need to do is making sure that we support those really great tech companies and those unicorns and those innovators, having that patient capital, providing that risk appetite, and making sure we support those next new champions across the continent.
Great, thank you, Richard. Caroline, yeah.
I would also agree that technology is critical, and technology transfer in all ways, but also local innovation. And that speaks to not just the manufacture of vaccines, but also the manufacture of other countermeasures, as Richard has said. But I would say also, you know, if you look at the case of mRNA and COVID, and the understanding that the research into the vaccine, not specifically the COVID vaccine, but the technology behind the COVID vaccine started years ago. And that investment in this paid off during COVID. So when we think about local manufacturing in Africa, we should not just think about the end where the manufacturing is happening, but how do we invest in these capacities in Africa so that we are not always depending on technology transfer, but we are actually locally developing technologies that can help both Africa and the rest of the world.
And if I might come back in here, if you don't mind, and I think at the heart of this is indeed partnership, whether that's, across the world, whether it's an American company, whether it's a European company, whether it's an Asian company, it doesn't really matter where it is from, but that partnership with the local actors on the ground, that is absolutely key.
Excellent point, Richard, as well. Hamid, would you like to respond to any of the comments made by the experts?
Yeah, so many things have been said, like supporting tech, innovator, and on the ground, And as Richard said, like we know better our environment. We know what is good, what is not good, what can use, and things like that. For example, through the maker spaces, we are building some prostheses for doctors, for so there are so many things, but sometimes I feel like we still lacking the right support, the right support to build like African technology. Still, we are doing a lot, yes, but yeah, it's always like the tech is coming from the north to the south. So my dream, and maybe like one day, like we will build technology from Africa, and then we can, go and explore the world,
And I agree with Hamid. I think there is more that can be done, especially in the space of public sector investment in health innovation. I think there are policies and regulations that need to be put in place to allow the public sector to invest in health innovations, because in many cases, health is seen as, a global public good. And if you're looking for venture capital, for example, which is looking for a return on investment, just looking at the bottom line, that is seen as a long, it's a long and hard road to tread in Africa. And it's easier to invest maybe in fintech, where the results are easier to see. So it is incumbent on us who are locally in Africa to understand what would it take to invest in and scale health innovations that have the potential to support surveillance, support R&D, support the tracing of cases. As we speak today, we don't know where our index case could be happening in any corner of any community across Africa. We don't know that. Yeah, we need to be able to invest in local innovation and find ways to scale it across the continent.
Thank you, Caroline, and thank you, Hamid. Richard, please. Yes, indeed.
I was just going to say, because I really agree with what Caroline said there about private equity and venture capital funds, and making sure that the environment is right in order to be able to attract those funds in and to build that scale and those African champions that Hamid was mentioning. And certainly, we at the EIB is what we're trying to do is to help to foster that environment and help to provide that support that can indeed catalyze those PE funds, those VC funds coming in and supporting African countries. Without that that investment and that institutional funding coming in, we will continue to just be playing around the edges. We need the scale, and we need those big funds to be made available across the continent.
If I may also ask, what is the role of the governments here, both European governments, the EU, and African governments? We're talking a lot about the private sector, but the responsibility is on the governments to make sure healthcare is available. It is a right. So what can we do what can governments do? And how can you foresee that kind of collaboration with governments? Both Richard and Caroline, either.
I'm happy. Caroline, would you like to start, and I can complement?
Sure. Sadly, I feel like the conditions that led to the last pandemic are still, in fact, the conditions that we have currently, maybe even worse. So if we look at the health systems are maybe the same or even weaker. We look at the health workforce and the migration of health workers from low-income countries to high-income countries. We look at the current economic situation. We are seeing that the cost of living is going up. The fiscal space is reducing. Africa is in a debt crisis. So when we are asking what can governments do, you know, I don't know what the answer is, because we are worse off today than we were before the pandemic. And I believe that we still haven't seen the end of the crisis that we are in now. For sure, governments in Africa, governments anywhere, can do better with you know, better planning, bringing in the private sector, looking at things like how do we get more health out of the financing that we have, out of the money that we have, not just how do we bring more money into this health space. But I would say the current economic crisis and the current debt crisis in Africa will continue to negatively impact the health space until that is addressed.
I think that's undoubtedly correct, and I think there are many places around the world that have seen their national health systems in a worse place now than they were 5 years ago prior to the pandemic. But I do think that there are still things that many African governments can do. So they can, you know, show that political will. So they can illustrate that national health systems, public health systems, pandemic preparedness, vaccine campaigns, that this is a priority for government. So I do think that they can do that. I think they can also make sure that, you know, regulatory systems are fit for purpose and are essentially preparing the right ecosystem in the countries to try and attract some of that that private sector investment into the countries. That is still something that is possible to be done. And I do think, and this is a really critical across the continent, is there is a regional angle here. So I do think governments can work alongside each other on a regional basis, and also with these continent-wide actors like Africa CDC, but having that regional foundation, whether it's aggregated purchases, whether it's making sure that there are the right systems for kind of cross-border transfers of vaccines are in place. There are steps that can still be done, notwithstanding Caroline's absolutely correct point about debt sustainability levels across the continent.
Hamid, you want to come in?
I just want to add, you know, for Africa, you know, like strong leadership, political commitment, effective governance are essential to fulfill, you know, the responsibility and navigate the global crisis. You know, like without this strong leadership and a real will, all the effort are going to be, you know, like it's going to be repetitive. We are going to repeat it and so on and so forth at any years, you know, of crisis, you know.
Thank you, Hamid.
If I could just add one thing, I think we've been having global discussions around universal health coverage, and that the role that plays in cushioning households against you know, impoverishment because of health expenditure. I think that is definitely one area that countries and governments can commit to, just ensuring that they are driving towards universal health coverage in the different countries.
Thank you, Caroline. I think that's a start of a manifesto. I see universal health coverage. So yes, let's continue the conversations on this very important point. I think taking a step back, and we've already started getting into the situation that our economies are in and how that impacts our society. Simina wanted to share her perspective on the broader impact of the COVID pandemic. Simina, over to you.
Thank you. My questions blends in nicely with the discussion that we've just had. We all know that COVID has deepened pre-existing inequalities in the world, and a collaboration between EU and Africa is certainly needed to tackle this issue. So my question to both panelists is, what are some main areas that we must focus on now in order to build resilience for the future for both regions?
I would mention two things, Samina. I would mention number one is One Health. So really looking at how do we look at health as something that is integrated as opposed to a standalone. We saw that it was health that brought economies to their knees. And how do we then ensure that as we look at health issues, we are not just addressing health, but we're looking at all the social, economic determinants and addressing them as the different players from the public sector and from the private sector. I would also mention climate change, because we are seeing climate change is really driving, different types of weather patterns, which are increasing, infectious diseases across not just Africa, but the rest of the world. So I think those are two areas that we need to focus on as we move forward.
Excellent. I guess I think the pandemic. Do you remember the phrase at the time that no one is safe until everyone is safe? And I think indeed that was really so clear when we were all worried about the different variations that were coming and the different variants, and it really illustrated that a global action was needed. This wasn't something where Europe or the US or Asia could act alone. We really were in it together, and variants were started across the different parts of the world. So I think it was really illustrated that we aren't alone. So I think from my side, 2 points I would say. One is that I think diagnostics is key. We need to have in place across the continent strong diagnostic systems, and this is not just for obviously for COVID, but for a whole series of diseases, whole series of health issues. If we have strong diagnostic systems in place in the public health systems and the private health systems, working together, I think that's really important to be in the best possible position for the next pandemic. And I think the other second point, and we've talked a little bit about it today, is this idea of regional champions. I think this idea that that West Africa, East Africa, Southern Africa, North Africa, was having to rely on vaccines that might come from India or from Europe or from Latin America. It's kind of faintly ridiculous now if you think about it. Looking back on it, we can't believe that was the case. So for me it's absolutely critical that strong regional champions need to be put in place across the continent, and that for me is an absolute necessity.
Great. One other element that we haven't really discussed, and it came up in the focus groups that we engaged in with European and African citizens, was the impact of the pandemic on women versus men. So women were clearly extremely affected by many of the repercussions of the pandemic. How can we address these different challenges now that we are in the post-pandemic phase? Again, how can we address the gender-related impact and prevent them from reoccurring and make sure that the gender inequalities are reduced? So Richard, perhaps?
Sure, very happy to take the first response on this one. It's a super interesting question actually, and it's a really important question that we don't embed even further these differences that were clearly manifested during the pandemic. I would say maybe 2 things from my side. One is that certainly the way that we're looking at this issue is that for every single one of our new interventions and every single of our new loans, what we're looking to do is in every program is to maximize the positive gender impact of our engagements. So this might be in designing the program, you clearly have a view of looking to protect, to extend the program so it has that disproportionate positive impact on women, and so they're not forgotten, and youth as well. It should be said it's women and youth. I think we saw as well during the pandemic. So that's really important. And I think the second point is a little bit this idea of communicating about it. I think we shouldn't hide this under the kind of the rug. Right, I think it's one of those clear points that we have seen as a result of the pandemic. So we should be talking and highlighting the point that this should be a focus for our policy interventions going forward.
Thank you, Caroline.
I would say in Africa, and if I speak specifically to the African health system, there are a lot of women who work in the African health system, and a lot of them are unpaid. They are volunteers. They are the ones who work in communities. During the pandemic, a lot of them were the ones who are going door to door, educating households and creating demand for the vaccine, and also for the appropriate behaviors. Many of these women were doing unpaid work. And during the pandemic, it was even, a greater challenge for them because they couldn't do their regular job in the market, selling tomatoes, etc. So this is something that we need to look at, this issue or this pandemic of women who do unpaid work on a regular basis. I think that needs to be addressed. I think also the role of gender equity. It's in many communities in Africa, it's very cultural to expect that women will be more subservient. Their place is lower in society than men or even boys. So how do we begin to address these things that we may not understand what they mean in the longer term, but during cases of pandemics such as this, then women end up suffering more than any other part of the society. I would also say that when we look at things like gender-based violence, mental health issues, how do we address them on a day-to-day basis, even without having the pandemic? Because the pandemic just made it much worse. So how do we bring these things front and center so that when there is an issue like a pandemic, then we already have mechanisms to address these issues?
If I might, I think, Caroline, your first point is really, really important. And certainly what we have seen when we're engaging with kind of commercial banks across the continent is we've put in place a whole series of new gender-focused lending programs in order to a little bit alleviate some of the things that we saw in the pandemic, making sure that female entrepreneurs are backed, making sure that financial products that more accurately reflect the life of a small female business owner, making sure we push those in response to the pandemic. We've certainly seen a bigger uptick of that in the last 18 months.
And I would add to Hamid's point on technology. Again, we see that women have less access to technology, less access to mobile phones, and these are the tools that kept businesses alive, allowed retailers to continue selling their products, being paid for services offered. So this is another area that we want to ensure that we look at, that women have equal access to technologies and the devices that they need on a day-to-day basis.
Thank you indeed, both of you, for raising these very, very important points. And there's much work to be done. Hamid, would you like to come in?
I would like to say, like, we must and we should, foster inclusivity and create, a safer space to encourage women to thrive in STEAM, like science, technology, engineering, and mathematics, and mostly like this lead to the tech fields, On the ground, for example, with Child Innovation, we are training women, we are training widows women, we are training women from the one who cannot even know how to write their name in a computer until the one who could. So, but this movement need also a big support, this movement needs support until, research, like women researcher at the university, they need a push. Sometimes they are like with the household, pulling them down, and they are not pushing towards what is their dream and what they have into their mind. So we must support the safer space for women from ground zero until researcher, to push forward for more tech field women, more women into driving change. And sometimes we do also research, but not for Africa. Sometimes we do research for European university, for American universities, and sometimes on the ground, those young people, we don't say it like, and we need to have an impact on our own ground, so that a new kind of girl, a new breed of girl will see that the research of Caroline on Kenya is helping this and that. So, you know, so many will be inspired and they will follow, like, I want to be like Caroline, I want to be like Simina, and so on and so forth. You know.
Thank you, Hamid, indeed. Simina, would you like to add anything?
I would also like to say that we need to work on our cultural beliefs. It's something that Caroline used to talk about, as well as invest. So we as a community need to work on making sure that our friends believe that they can study engineering, and that they, if they're given a phone, they will learn how to use it, and really work on a community basis as well.
Well, it's been a really enriching discussion. I wish we could continue on, but it's given me a lot of food for thought, and there have been really interesting points raised by each one of you, and I hope it's been enriching for you as well. So thank you everyone for joining us this afternoon. And I invite everybody to log on to debatingeurope.eu to watch more of such discussions, and please stay connected with us for more. Goodbye for now.